Okay, my name's Leon Wright. I teach on health and social care and the sport pathways. Today I'm going to give you an overview of leadership styles and what to expect in a health and social care classroom. So there are a few important aspects to consider when you're moving into healthcare professions. One is that you're going to be leading small groups of people, and two is that you're going to be a member of that group and you need to understand how to react in what can be typically really difficult situations. So generally there are three aspects that we need to consider when looking at leadership styles. One is the situation that you are put in. Two is the leader themselves and their experience. And initially, you're not going to have a great deal of experience. And finally, the group and the members yourself. So the people what make up that group. Are they experienced? Are they specialists? Are they new to the career pathway? Okay, so the three styles of leadership are influenced by your leadership choice. You've got three choices when looking at leadership. One would be an autocratic choice, which can also be known as task-orientated. Task-orientated, autocratic styles are leaders that make very quick decisions and the team, the members, have to follow those decisions. Hopefully that's quickly, it's not reactive, and it's with high precision. So if you can think about any particular scenarios or moments where that would be most favourable and any scenarios where that would be least favourable, that would be great. Another leadership style to consider is democratic. This is what's called person-orientated style. This is a time where we try to invite and open up the opinion of others to pitch in and be involved. So can you again think of moments where it's worth getting people's opinions and having a viewpoint to allow them to feed back in? One final style is classed as a laissez-faire style. This is a style where you allow your team to evolve naturally and go about their business day to day. Again, if you could think of some good examples where that style might be most favourable and least favourable, that would be great. One of the models we look at in health and social care in terms of least and most favourable is referred to as Fiedler's contingency model. Fiedler suggested that we have an optimum time to be either autocratic or democratic, so task-orientated or democratic in our style. Fiedler suggested, and I assume you've got some very good examples, that it is best to be autocratic in your style when the conditions are least favourable and most favourable. So when conditions are least favourable, we could have patients in critical care, we could be in a situation where it's a life or death choice, and we need the leader to make quick, decisive decisions, and the team need to know exactly what to do. When it is task-orientated and the conditions are, most favourable, you need to consider that when the autocratic leader makes a decision, the team are highly cohesive, they work well together, and they're able to do and carry out the task really, really quickly. So Fiedler suggests that being autocratic is best when conditions are most favourable and least favourable. The only time Fiedler suggests that a democratic style would be most favourable is when conditions are seen as moderate. So this could be a time and an opportunity where we reflect upon practice. How did we approach a situation? Are there new members coming into a team? Do we need to carry out an induction? Do we need to listen to experienced practitioners' viewpoints and build up a structured plan in order to develop our practice? There's one more model that we would look at in health and social care in regards to leadership. This is referred to as Chalandri's model. Chalandri demonstrates the complex nature of leadership. In order to remember this model, we use an acronym called SLM RAPS. The antecedents refer to the characteristics of you as a leader. So we have a particular situation that we're in. Is a patient critical, or are they in early care, or are they just coming into a casualty situation, or is it GP referral? What are your leader characteristics? Are you new, experienced, or somewhere in the middle? What is your group or your group members made up of? These are all three antecedent factors that make up your leadership decision. The leader behaviour is centralised around what you actually do. Now, the situation requires you to behave in a particular fashion. If a patient is critical, you have to behave in a particular way. You have to be reactive. A good example is if you were going on a rock climbing expedition, it would be required that you need to be autocratic and tell the group exactly what to do to be safe, because it meets legislation and it allows the group to be safe, and they would then in turn prefer you to tell them exactly what to do to be safe. So that can be applied to a number of different settings. So when we look at the member characteristics on SLM RAPS, The members also have a preferred behaviour that they would like you to do as well. So for example, the preferred behaviour of a member from a doctor would be that they would want to be treated for their illness. If you didn't treat them or you didn't pay them the correct attention, that might result to them being unhappy. That all feeds into your actual behaviour. Depending upon your actual behaviour, depends upon the performance and satisfaction of that end result. A good example of that would be if, for example, the patient didn't agree with the type of care that you presented and you performed that care, their satisfaction would be seen as quite low. Okay, so to conclude, Chalandri's model demonstrates the complex nature of leadership. You're going to be faced with many difficult situations in the health and social care profession. Your leader decisions are not always going to be correct, but what we're going to try to do is develop your knowledge in order for you to get this performance and satisfaction exactly where it should be. Accept that it's not always going to be right, but in practice we can work on these theoretical underpinnings in order to give you the best chance of success when you go into practice. What we're always trying to do is match the preferred behaviour of the member with the actual behaviour of the leader, and that would allow us to have high performance and satisfaction. So again, we would look at laissez-faire styles of leadership, autocratic styles of leadership and democratic styles of leadership, and how you would apply them in a healthcare setting. Thank you very much for watching. I hope what we've covered today gives you an insight into health and social care, and I hope to see you at one of our open events. Thank you.